Welcome at ESC 2012. My name is Gregory Ducrocq. I'm interventional cardiologist working in Hôpital Vichy in Paris. I'm also the chairman of the EAPCI Committee New Initiative for Young Interventionists, and I have the great honor today to interview Dr. Jean Fajadet. Jean Fajadet is the president of EAPCI, is an interventional cardiologist working in Toulouse in the southwest of France, and his career has been a source of inspiration for many young interventionists. So my first question to you, Jean Fajadet, is do you remember why you decided to become an interventional cardiologist?
Good morning, Gregory. The question is not so difficult because I remember very well. You know, I was what we call internes hôpitaux in France in 1979. And during my first stage in internat of 6 months, I was in the interventional unit of cardiothoracic and vascular surgery. And at the beginning, the goal was to become surgeon. And I met a very nice person, Professor Bocalon, which was a responsible cardiologist, responsible of ICU. And after spending 6 months with him, he convinced me to stop, to change the way and to start cardiology studies. And it's the reason why I became first cardiologist and second interventional cardiology. Why interventional cardiology? Because at the beginning I tried electrophysiology. I was certainly I felt well in a cath lab, but to be honest, electrophysiology was too complex for me, for my brain, and I moved to the interventional cardiology. And I was really lucky and had a chance to learn interventional cardiology with Jean-Marco.
Okay, so my second question is for your younger colleagues. What are for you the skills required to become a good interventionist?
I think that this question is more difficult. We need some criteria. The first is certainly the patient of your work. Why? Because it's really quite demanding in the hours of working, demanding physically. Physically, sometimes after a full day in the cath lab with a leather protection, you could feel a little bit tired. Then you need to be attracted by the ambience of a cath lab or operating theater. The third is you have to be ready and to have the right response for emergency, for acute cases. And we have more and more acute cases. For example, primary PCI in STEMI or patient arriving in shock. So we need to be attracted by this kind of thing. And then there is a spatial criteria. In other way, the way to work in the cath lab is to look non-stop, 100% of the time, on the flat screen, which is in 2D and black and white. And you have to represent what you see on the screen, represent in your mind, in your brain, what is the situation in 3D anatomy. And you have to work without looking your hands, but just looking this flat screen. So it's quite complex, but of course this can be done. But you have to learn.
You were talking about Jean-Marco. Would you qualify him as a mentor for the beginning of a career?
Absolutely. Absolutely, and really all my career in the interventional cardiology was impacted by from the beginning, the mid, and the current, and now by Jean-Marco. And I think it's important particularly when you are young, to have a mentor, to have a leader, and try to be identified to this leader. And I have a second chance in my in my career, it's when Jean-Marco and myself, we decide to send me several months in Kansas City with Jeffrey Arzler. Arzler in 1985 was the leader with Andreas Gonzik of Interventional Cardiology. He was the first guy we did who performed primary PCI in acute MI. He was the first guy who performed PCI in multivessel disease, PCI in patients with low ejection fraction. And really, I spent it was a little bit more than 2 months in the cath lab. I had a chance to have really private lessons with this guy, which was at that time the Pope of the great leader of interventional cardiology.
So you would recommend a young interventionist to choose a good mentor. Do you have another great advice you could give to a young interventionist starting his career?
I think that and this is maybe what I did not wrong, but and now it's too late. I would like at that time to leave our hospital, my hospital, and particularly to go to US, for example, in Kansas City, for 1 year. Because really, first, you improve your English. It's not our mother language. And the second is to really feel the way of working, the way of the organization of this cath lab in US. It's important.
So you explained us that several points were very important for your career. At the opposite, if you had this opportunity, what would you do differently if you had the chance to do it again?
Differently?
Yeah.
It's difficult to see because really I was lucky. You know, in your life, sometimes you have good opportunities. And this is part of you are lucky or you're not lucky. You have good opportunities, you have not good opportunities. And really, personally, professionally, I have a lot of good opportunities. So really, I regret absolutely nothing. And I wouldn't change anything if I have the possibility.
My last question would be a little bit more personal. What is for you the good balance between professional and private life?
It's more difficult. This is difficult because interventional cardiology, really, it's a passion. It's a passion. We do not count the hours of work in the cath lab. And the second point is when you have the chance to be in the large center, you have not only the daily practice, but you have clinical research, etc., the meeting like this, etc. And at the end, you spend a lot of time with your colleague in the department. And of course, the price to pay is you spend less time with your family, with your kids, etc. So I was afraid during several years, particularly with my wife was very comprehensive. She's a medical doctor, so she could understand that, but not in cardiology and rheumatology. But I was afraid for I have 2 daughters, and how she will feel this absence of the father in the family. And finally, now the oldest is the first one is 31, the second is 27, and really there are absolutely nothing to say to their father. So they are really happy. So finally, it's a good story.
So thank you, Jean Fajadet, for sharing your experience. I'm sure that a lot of young and less young interventionists will find some inspiration in what you've said. Thank you.
The last word, the most important word is a patient. Patient to your work. Okay?
I'll keep this in mind.
Thank you.
Thank you.